I am very excited to have Dr. Laura Klenke-Borgmann join us today. So thank you, Laura, for giving us some time. Can you just maybe introduce yourself and share a little brief overview about the program that you are in charge of?
Sure, absolutely. Hello, nice to be here with you, Amy. I'm Dr. Laura Klenke-Borgmann. I am the Director of Simulation Education and Clinical Associate Professor at the University of Kansas School of Nursing. In my director role, I oversee our simulation program and our simulation curriculum that includes both undergrad pre-licensure students and also graduate D&P students. So I see kind of students on both sides of graduation.
The mighty big program you have there.
Yes.
So I know we're really going to talk about your experience with competency-based education and some specific solutions that you've used to help develop your students specifically in the simulation labs, of course, but also across the program. So what specific challenges or programs did you identify when you started this shift to CBE or competency-based education within your curriculum at Kansas there?
Sure. So I'll start by saying the thing that I really loved about it, and the reason that I really wanted to change and pivot our focus a little bit, was in the true spirit of competency-based education. I love this idea of it's competency-based education is more about the output that our students can show us and what they can actually do. And how the focus and the importance is so much more on that than the input, just what we tell them, what we teach them, what we say our objectives are. So I think we know that, this big gap that we know exists between academics and practice. I think one of the ways we can close that gap is through not just focusing on what we told them, but what they're actually able to show us. And so I'll just preface my answer to your question by saying that's why I'm so excited about it, is because it's about what they can do and what they can show us. That being said, in the true spirit of competency-based education, one of the sort of challenges or problems was getting over, not just for myself, but for the students and faculty, getting over this traditional way of thinking about learning and about evaluations as for a grade, right? Good, bad, pass, fail. I got a 97%. I got a 73%. With competency-based education, it's more about what you can do and what you can show us, and how many times it may take you to be able to show us or do. May be an iterative process, and it may be a different pace than the student to your right or the student to your left. And that can be really, really difficult for students to understand, since that's not how they've been evaluated since, like, I don't know, kindergarten. And also it's hard for faculty to kind of wrap their head around that thought as well.
Yeah, I think that's so true. It's a big shift, not just in how we teach, but also in how our students learn and receive their
Yes.
feedback and assessment.
Yes.
And so it's a big change for everyone. And so how do you get them all on board is kind of that $1 million question, which
That's right.
I know.
And a grade has been such the currency for students' motivation, even for them to sort of study or practice or how they're going to perform has, unfortunately, for better or for worse, sometimes it's been their motivation is getting that grade. And so without the grade, it's hard for them to wrap their head around, well, what's my motivation and what am I supposed to accomplish?
Yeah, we have to really show them what that means. So
Right.
I know you've been doing a lot of work with a sim zone based approach to
Mhm.
transitioning your sim program. And can you just explain a little bit how you implemented that and then how you scaffolded some different learning modalities to enhance the learning outcomes?
Sure, absolutely. So, for those of the listeners who may not be as familiar with SimZones, it's a organizational sort of scaffolded framework by initially by Rusin and Weinstock, that basically is a framework for how to sort of plan and scaffold a longitudinal simulation program to get to some type of competency-based output at the end of the framework, if you will. And it basically consists of 5 zones. Zone 0 is basically saying that learners have to have, before they can show us or do really anything, they have to have that baseline foundational requisite knowledge. So that's kind of what the framework of Zone 0 basically is that we know students have to come to an experiential learning experience with some type of baseline requisite knowledge, let's say from classwork or automated feedback that they've gotten from maybe a virtual sim or something like that. Then once the students have sort of achieved that level, the framework says that you move the learner to zone 1, which is just basically as we think of as sort of deliberate practice. So deliberate practice of psychomotor skills, not really context-based, just practice, practice, practice of, let's say, giving an IV push medication or hanging some IV fluids. So that's zone 1. Zone 2 takes the learner up to another level where now they're practicing those psychomotor skills that they sort of did in zone 1, but now in a context-based format. So maybe it's not just coming into the lab and practicing deliberate practice of psychomotor skills, but now they're doing those skills in the context of a case. So more like a simulation, right? But now that because it's contextual and it's still coaching, they can stop and start the sim, they can ask questions, they can get feedback from the faculty or from their peers, and it's like a sim, but it's more contextual. Then once we're sort of accomplished in level 2, we can take them up to zone 3. And that is what people would think of as more of a traditional simulation, where they get pre-briefed, they do a sim, they don't get stopped no matter what happens, and then we debrief them afterward. So that's zone 3, essentially. And then zone 4, it really isn't simulation at all. It's them actually taking all of that knowledge and all those leveled experiences and taking now that into practice and actually doing in the clinical setting. So that's just kind of a really brief explanation of SimZones. When I first learned about it, I was like, yes, that's it. It's the organizational framework for which we know we have to move our students, but it's just so wonderful to have it laid out step by step like that, for us to kind of start to scaffold and organize our own experiences for our students, and ensuring that we've moved them through the right levels and not just throw them into something that A, they're not ready for, and B, we haven't ensured that we've set them up for success.
I think that's so important what you just said, that they're not ready for it. And I think sometimes that's where we see that cognitive overload is when
Yes,
students are thrown into a sim that they maybe don't have some of that practice, practice in level 1
that's right.
or 2, where they've really gotten the exposure and they feel comfortable to then put it all together.
That's
So
right.
giving that feedback and coaching and laying a nice foundation with opportunities to practice, as we know AACN has really advocated for,
Yes,
is
right.
going to be so important. So I know when
Yeah,
you and I had chatted before, you had a specific senior level course that
yeah.
you were recognizing students weren't quite ready for that traditional sim. So I wonder if you can talk through that experience of uncovering that challenge and then how you kind of use this approach and some simulation activities to rectify that for your students.
Yeah, for sure. Absolutely. So here at the University of Kansas School of Nursing, at the very end of program for our senior level nursing students in their very last semester, for quite some time, there has been a multi-patient simulation as part of the curriculum, truly at the end of the program as they're transitioning out to graduation. And whenever I took over as the director, I noticed that, I mean, the sim is great. Like I will clearly say the simulation is very well designed. It's very thought out. The faculty do an amazing job at it, but goodness, the students were struggling. They were really struggling with putting all the pieces together, right? Of delegation, prioritization, remembering all of their psychomotor skills from the entire program, putting it all together, managing interruptions. Like it was hard. They were really struggling with it. And so in that first year in my position as the director, I was thinking, there's got to be a better way that we can set them up for success, right? We have to think of a better, more intentional, more scaffolded, backward designed approach to set them up better for this end of program simulation. And so that's where SimZones came in. I thought, if we can sort of work backward and start at the beginning of the semester with intentionally preparing them and moving through those zones of SimZones to get them ready for that very intense, overwhelming kind of multi-patient simulation, I think we can use that SimZones approach as our organizational approach. And so that's exactly what we did. We ensured that we kind of started with zone 0. We knew what the end product was going to be. We knew in zone 3, we wanted them to be able to perform this simulation in this in-person multi-patient sim. So we thought we worked backwards. So we ensured that in zone 0, as students started their end of their last semester, that they had the requisite knowledge to do so, right? So ensuring with faculty and the courses that they were taking that semester that requisite knowledge would be there as their foundation. So we ensured that was there. Then for the psychomotor aspect of the skills that they were going to be asked to do and required to do in the multi-patient simulation, we scheduled and designed into the curriculum a multi-patient sim lab day, so this is zone 1, right? This is the deliberate practice of those psychomotor skills, where we intentionally created a lab session for them to practice skills that they will be required to do in multi-patient sim. So central line dressing changes is one of them, nasogastric tube placement, IV push medications, wet to dry dressing changes. So these are all things that we knew they were going to have to do and that they were struggling with in multi-patient sim, because some of it has been a while since they've done it, if they didn't get opportunities to do it in clinical or whatever. So that was our zone 1, was this multi-patient sim skills day lab. And then once they kind of got that deliberate practice of those psychomotor skills, we moved them up into zone 2, which is more of the contextual learning, but still being able to stop, start, and ask questions. And that is where vrClinicals came in. Because we knew, sure, they had the psychomotor practice of the skills in zone 1, but we still wanted them to get some great contextual prep with the cognitive skills that would be required in the deliberate practice or in the multi-patient sim. So vrClinicals was fantastic for that, because in the VR medium, they were able to practice those cognitive skills of prioritization, delegation, deciding what patient they're going to go see first and why, managing interruptions, managing, unexpected things that pop up throughout the scenarios. And so we felt that putting vrClinicals in that zone 2 was a great bridge, if you will, between zone 1 cognitive, or I keep saying cognitive, zone 1 psychomotor skills, and then actually getting them ready for putting it all together in an in-person multi-patient sim. So the multi-patient vrClinicals was a great bridge to bridge the psychomotor skills, the cognitive skills, and put it all together for that zone 3 in-person multi-patient sim.
Awesome. And, I think it's such a unique solution, the vrClinicals for nursing, because it does give that contextual experience, like you said, because it's hard to understand, when interruptions come up and you're with one patient, do you leave and go to another patient? Or,
Right.
When there's another patient that has a change in status, how does that affect the care of the other 3 patients that you're in charge of taking care of? And so students don't get a lot of exposure to that, to give them just the one experience at the end of the semester, which is, I think, pretty common across a lot of nursing programs, without the ability to practice and have that exposure and context is challenged. And I think that's, what you said you saw. And I'm really excited to hear that that's a solution in a way that you've scaffolded it, mixing in that psychomotor skill lab as well, to be sure that they can do this actual skills once they get there. How have your faculty and your students responded to using vrClinicals in this way, and maybe just to the format as a whole?
Yeah, well, it was in terms of your specific question about vrClinicals, it was definitely a transition for us. It was a big change. It was the first time we really, in earnest, have incorporated intentionally VR into our sim curriculum here. So, certainly there was a learning curve for myself and the faculty who were going to be leading those. And, it was a learning curve for the students as well. It was interesting. We kind of made the assumption, myself and the faculty involved, that that students were, how it is with we as faculty think, oh, the students are like so much more evolved than us in terms of the technology. And certainly there were students who were, but there were still a lot of students who truly needed the hands-on practice time, the orientation, the tutorials, even more so than maybe I sort of expected. That they weren't just like all gamers that just like jumped in and knew exactly what to do, So the tutorials and the orientation that the vrClinicals provided was definitely helpful and needed. for us and also the students, because you want the experience to be about the learning and about them making their decisions and all of those cognitive skills that I mentioned, the delegations, the prioritizations, not troubleshooting the tech, right? And so
Yeah.
yeah, we wanted the objectives to actually be able to get accomplished, not spend the whole time troubleshooting the tech or explaining them how to work the hand controls and things like that. So I'll definitely say the tutorials and the orientation that come with vrClinicals was a huge asset in that respect, in sort of onboarding and getting everybody up to the same level and the same speed to actually then be able to jump into the learning. So I'll
How did
definitely
they
say
feel about
that.
the actual content and experience of being in once they were comfortable?
Yeah, no, I think they really did enjoy it. And like I said, for a lot of students, it was a new experience for them, which they liked. Like they liked that novel aspect of ways to practice, as you said, things that they're not necessarily always getting an opportunity to do in practice or in clinical or even in simulation all the time, to be able to be in that immersed environment where, I had so many students say as we were debriefing afterward, like, it's just so hard to know where to start. Like, I can't tell you how many times students said, like, I just kind of got into it and got on the unit and was like, what do I do?
I go.
I know, where do I
Yeah.
go? Who do I see first? How do I even get started? And so I think that is a huge value to this particular product, is that realism of sometimes we know that new grads feel that sort of, paralysis by analysis of like, I don't even know where to start. I'm overthinking all these things and I'm thinking through things and I don't even know like how to begin. And that came out loud and clear a lot in the debriefs after our VR sessions, of that was really good for them to be able to have that experience of like, oh, wow, it's just me now. And I have to make a decision and I have to start. So they
Wow.
really enjoy that realism aspect of just starting on the unit and let's go.
Keep report and go see 4 patients. Yeah.
That's right. That's right. Yeah.
That's wonderful. And how have your faculty and students responded to the complete scaffolded approach? Are you seeing some better outcomes in that
Yeah.
multi-patient sim now?
Yeah, we are. So in the multi-patient sim, we have been, and again, we're not done yet because the semester is still going on. So we don't have like all the finalized data, but we are collecting some data from the multi-patient sim. Specifically, we have a competency checklist that we're sort of being able
Oh,
to
great.
evaluate the students on, that includes sort of the competencies that we're looking for. So obviously the basic things like doing a good assessment, hand hygiene and safety, doing the 6 rights when they give a med, communication with the patient, clinical judgment, but then also looking more at some of those skills that are higher level, because it is the end of the program. So prioritization skills, management of interruptions, things like that. So we're collecting that data. The other thing that would be, I want to make sure that I share, because I think this is particularly interesting, is we also collect data on the students when they're done in the multi-patient sim experience, on their cognitive load.
Oh, wow.
So
Yeah.
we use the NASA TLX tool. I don't know if people, or some people may be interested or familiar with that. Others may not be, but it basically is a valid and reliable measure of cognitive, the participant's experience and perspective of cognitive load. And it asks specific questions regarding like temporal load, like how rushed in terms of time they felt, physical load, like how actually tasking or physical their load felt, obviously cognitive load, and then some other things that it measures just by like on a Likert scale. It asks them to fill that out. We actually had the students fill that out in last year's cohort, and now we're having the students fill it out in this cohort to see if there's a difference in their cognitive load now that this cohort has gone through this scaffolded approach of preparing them better for that multi-patient sim. And so we'll be really interested to see the final data of that, to see whether or not their cognitive load is
Yeah.
diminished based on this intentional prep that we've done for them. The other thing that I will say is that I think students have appreciated about the inclusion of VR into this scaffolded approach is that it is truly now, because we've included VR, it is truly a multi-modal scaffolded approach. So, like I said, in zone 1, we're talking about psychomotor, deliberate practice. In zone 2, we are doing VR. And also, by the way, I didn't mention, I mentioned that they have 2 different VR sessions that they do like a week apart in zone 2. One of them is the 3-person 3-patient one, and then we level them up the next week when they come back to the 4-person. So we even scaffolded the VR clinical into that approach. And then in the actual multi-patient sim, they have standardized patients, playing patients, and we have high fidelity mannequins. So it's a mix of
Wow.
different types of patients in the multi-patient sim. So truly, from beginning of the process to the end, we basically have hit all the modes of simulation there can be
I think what you've
from
done
all
though
those
is
realms.
really,
Yeah,
capitalize on the learning outcomes. There's things
yeah,
that mannequins can do, and there's things that standardized patients can do. There's things
that's
that
right.
VR can afford you, and there's things
Yeah,
that, old task trainers can still afford you as well. And
yeah,
so
right.
when you're looking at what is the outcome we're trying to meet, it's so important to match that modality to outcome. And so
That's right.
finding solutions, mixing solutions like you've done, I think is just a really beautiful picture that you don't have just one thing because you
That's
really
right.
need a variety, not only to tap into different learners and to different students, but this is a senior level course where students probably can have some autonomy to say, come to lab and practice these skills.
That's
You don't
right.
need to have, a faculty at each station. They've done these before, but you have
That's
somebody
right.
there to assist and to help. And then the VR really gives them that scaffolding within the solution as well, support when needed, more complicated scenarios as needed. And then, like you said, the 2, 3, or 4 patient experience, depending on what they're ready for. And you can
Yeah.
keep increasing that cognitive load as
Yes.
they show that they're ready for it, which I think is really
Yes.
cool. So
Yeah.
it's just
Yeah.
such a neat example of how you've utilized simulation to scaffold learning and really build towards competence of your students. And I hope you all are feeling really proud of yourselves. And I
Well,
can't wait to see
thanks.
the data,
Yeah, me too.
of course. So I think everyone should keep posted, of course. I know that Laura has published an article on her SimZones approach, and we'll be sure to share the link in the chat, and also the podcast with the National League for Nursing,
Yeah.
the Edge Unscripted. So we'll share the link to that as well in case people are looking to learn more. So
Yeah.
I just want to thank you for your time. And if there are any questions, is it okay if folks reach out to you and we share your email address?
Oh, sure. Absolutely. Share my email address. I'm also pretty active on LinkedIn, so you can definitely
Yes.
find me there too. So
Yes, you are. You're a busy, busy person.